is when we need to give you blood from someone else.
Okay.
Yes. So when you're administering blood from someone else, we call it a blood transfusion. So at some point,
for that to be a case that happens.
You may need blood. You may need blood in various situations, various scenarios. So there is a level of hemoglobin that we expect you to have for your body to operate normally. Because blood is a very important part of our body. Right. So if your blood levels are low, we may need to give you blood. Let's say you're bleeding a lot, your blood levels can go so low, so that you're now unwell for various reasons. You can be bleeding after an accident. You can be bleeding. Let's say something is happening in your body, so that you're bleeding internally. In females, talk about ectopic pregnancy. Let's say in ectopic pregnancy, you can be bleeding in your pelvis during labor, or before labor, or after labor. Women also bleed a lot, so these may also need a blood transfusion.
Okay. Now, can anyone donate blood? Tongoti, I feel like I want to help. There's been blood drives happening across the country.
Yes.
Can anyone donate blood?
Anyone can donate blood, Simba.
Okay.
Anyone can donate blood. But unfortunately, most people in our community, they are afraid of donating blood.
Okay.
Maybe because of fear of needles, maybe because of...
When you pointed not when you said that?
I don't even know.
Because Knox is afraid of needles. Maybe because of fear of needles. Also, there are also a lot of misconceptions that people talk about when it comes to blood transfusion. Some say, if I donate my blood, they'll get my blood for free. And then, with no pay, as you have to say. And some are saying, I will donate my blood for free, but when I finally need blood, let's say I need blood 2 years later, I have to pay for blood. So there are a lot of misconceptions that result in people not donating blood.
All right, Doc. Now that you said that, and I think the conversation here, I don't donate blood because when I now need blood, I have to pay for it. What happens after you've taken my blood, I've donated blood? What happens after?
Biscuits.
Right.
Listen, I ain't gonna lie. In high school, I used to see people go just for biscuits and drinks.
Yeah.
That is why most people who have donated blood, they last donated when they were in high school.
Yeah.
Because the motivation will be to get the drinks and the biscuits afterwards. Yeah. So blood is free. Blood is free. We don't pay for blood.
Okay.
But we pay for the services that they have to do after they collect blood from you.
Okay.
The screening, the transportation, the storage, the separation of blood. Because when they get blood from us, they separate it into various components. Because blood has got a lot of components. So there is whole blood. So we can transfuse whole blood, or we can get the platelets. So they can separate just to have the platelets. They can also separate to have what is called fresh cells and plasma. And then they can also separate what is called packed cells. So all those processes and screening for infections, that is what we ultimately have to pay for.
All right, Doc. So what's the one thing? So like you did, this is building on screening.
Yes.
What's the one thing that will then lead to people at the National Blood Services saying, okay, we can't use this blood? What would be in the blood?
So they screen for various infections, Nox.
Yes.
Because imagine if you're getting blood from someone else, you're also worried. What if I get HIV from this blood? What if I get other infections, hepatitis and other infections? So they screen for various infections. But let me just take this time to say this. Our blood transfusion processes here in Zimbabwe are very safe.
Okay.
The incidence of transfusing blood that has got all these various infections in Zimbabwe is close to zero, if not zero.
Okay.
Are there any alternatives to blood transfusion?
Yes, Simba. You know that there is a religious group that doesn't accept blood transfusion. So these guys, when they come to hospital, they'll say, if you know that they go to this church, we're not going to mention the church, but they will refuse blood transfusion. So some of them, they opt for erythropoietin. Well, when we give them erythropoietin, it stimulates the body to produce its own blood on its own. But however, the process may take a bit long. But sometimes you want to give blood fast so that this patient survive. So the process can take a bit long. If your hemoglobin levels are mildly low, we can give you the iron tablets. I'm sure you've had people that are on iron tablets. There are other drips that we also give if the hemoglobin level is not so low.